Welcome to VidZet. I'm Dr. Ted Noel. Every time I think that the last shoe has finally dropped, I discover that Hillary Clinton has actually emailed a Marcos. And if you didn't get the joke, you're probably too young. In any case, this has become a tale of two stories. And the key to this is information that I received after my last post from one of the pioneers in neuroradiology. That is radiology that looks at the brain and the spinal cord. And of course, that's where a whole lot of what we've been talking about goes on. Our first story comes from Hillary Clinton, and it says that somewhere in the first part of December of 2012, she fell, hit her head, and got a concussion. She sent a message to Congress saying, I've got this concussion, I can't go see you guys and tell you everything that happened in Benghazi. And that message where she talked about my cracked head is dated December 20. Now, on December 30, Dr. Lisa Bardak tells us that Hillary had a, quote, routine follow-up MRI of her head, and it demonstrated a transverse sinus thrombosis. She then, 3 weeks later, is doing well enough after she's been put on blood thinners to come in front of Congress and with a very clear head discuss all of the things that are going on about the Benghazi event. The only problem with this is that her husband, Bill Clinton, tells us that she had a lot of problems and it took her 6 months to recover from her concussion. The second story is hypothetical, but it fits the facts. We know Hillary Clinton is a very secretive person. She only wants us to know the good things about her. And we also know from WikiLeaks that in 2011, her attorneys sent her a memo on a number of things involving the Clinton Global Initiative, including the fact that a gentleman named Mark Lazary, who was holding a lot of the debt for the National Enquirer, was on board with squashing uncomplimentary stories. Then, in 2012, the first week or two of December, she goes in to get a deep brain stimulator so that she can take care of these tremors that are going on and look a whole lot normal because she knows she's going to run for president. She invents the story of her fall and concussion to delay testifying in front of Congress. While she's recuperating from the deep brain stimulator, she sends a note to her staff that she will be at home nursing her cracked head. Well, she's using an expression that's common in medicine for people who are having neurosurgery. You know, we talk about cracking someone's skull, but it's a little uncommon for people who fall and hit their head. So it may not be proof, but it's a little odd. A couple of weeks later, after this thing is in, she starts having trouble with vision because the clot in the transverse sinus is pushing on the part of the brain where you see. So she goes in and gets a follow-up MR scan. Now, Dr. Bardak calls it a routine follow-up to a concussion, but concussions aren't routinely followed up with another MR scan. When the MR is read, they find the clot in the transverse sinus and put her on blood thinners. The purpose here is basically to keep the clot from getting larger, and hopefully her problems will resolve. About 3 weeks later, she is in good enough shape to testify in front of Congress when she displays that "what difference does it make now anyway" moment. Then her medical history basically goes silent. We don't see anything until this year. But lo and behold, there is something that happens in 2014. She has an MRI scan done. Now, let me say this. We don't know where we got this frame, but we do have enough evidence now to say it is most likely a true frame from an MRI that she had. It has her name, it has her date of birth, and those are in the correct font and the correct placement for an MRI. There are some other things on this MRI that if they were wanting to put out a frame of something to say, oh, everything's normal, they wouldn't have done. But most people wouldn't know to pick up on what's actually there. This is where the neuroradiologist picked up on things. If you look in the upper left corner of the frame, you will see the word flare, F-L-A-I-R. I didn't think anything of it because I didn't know what it meant. But he points out to me that this is a very special technique that's used. Most of the time, other techniques get used for MRs. But because the concern here is that she might have bleeding, and it's possible that she had some symptoms of some sort, that she would have a scan that's designed to pick up even the smallest amount of bleeding. And this FLAIR technique, which stands for Fluid Attenuated Inversion Recovery, is exquisitely sensitive at picking up bleeding. Not only that, if we look outside of her head on the frame around the actual scan, there is a foggy distortion that occurs, and it's patchy. This tells us that this scan was done on a low strength magnet, either a conventional low strength or an open MRI machine. This kind of distortion is characteristic of those machines and doesn't occur on the higher strength machines. The reason for using a lower strength machine is that a deep brain stimulator lead is an antenna, and when you do an MR scan, it induces currents that create heat in the MR element. Obviously, if we do too strong an MR or too long an MR, you're going to create heat, and you really don't want to cook your patient's brain. So when you're doing the MR scan, you take every precaution to avoid it. A low strength coil and the FLAIR technique allow you to do exactly that. You do a safe scan that's exquisitely sensitive in picking up the bleeding that could come from her anticoagulation. So let me recap. Hillary Clinton is very secretive about her health. She gets any health stories at the National Enquirer killed. Then in the first part of December 2012, she gets a deep brain stimulator to help with her tremors. A couple of weeks after that, she starts having visual problems and gets an MR to figure it out, and lo and behold, she's got a transverse sinus thrombosis. She gets put on blood thinners and is doing reasonably well, and 3 weeks later, she's in front of Congress for the "what difference does it make" moment. We don't hear anything for another 13 months when there's another MR scan, presumably because she's having some sort of symptoms that they want to check out. And this MR scan gives us the clues that we need to understand what's going on. It happens during a week with no appointments. It has distortion that indicates it's a low strength coil when normally we'd be using high strength coils, but because she has a lead, they stay away from heating, and then they use a technique that's exquisitely sensitive in finding bleeding. All of these things fit with our story of Parkinson's disease, and they fit better than they do a concussion and post-concussion syndrome. I'm Dr. Ted Noel. Thanks for watching.